So here we are once again. We're doing our second PRP of the day. Again, I just want to reiterate, we're going to go through the three parts, part 1, 2, and 3. Part 1, we're going to be drawing blood. Today we're going to be drawing approximately 30 cc's of blood. So we're going to go ahead and perform the first part of the procedure. Part 1, we draw blood. Part 2, we did part 1, we drew the blood. Part 2, now we have the blood here and we're actually not necessarily processing, but we're getting the blood into the correct containers. And what we're going to do with these, with this container, which contains the 30 cc's of blood, is we're going to move that into the centrifuge, which is what spins the blood, and that separates the blood into good and bad. So the bad will eventually not use, and the good we're going to keep, which is the plasma, which is, again, platelet-rich plasma. The plasma contains platelets, which contains important growth factors and cells that aid in the regeneration of damaged tissue. So once we have the plasma, then we'll go to part 3, which is the actual procedure. And we'll go ahead and give you guys another clip of part 3. So, just like I promised everyone, part 3 of 3. So what we have done is we already isolated the plasma, and we have the good fortune, depending on the clinical presentation, we're able to isolate if it's 1, 2, 3 cc's of plasma. The more blood that we're able to isolate from the patient, whether it's 30, 60, or even more, that obviously helps us to concentrate more platelets, which is exactly what we want. So again, depending on the clinical presentation will dictate how many cc's we use. In this case, we've isolated 3 cc's, again, of plasma. And just to refresh everyone's memory, plasma contains the platelets, which contains the important cells that will help in regenerating, in this case, the damaged tissue. This is a very young patient who sustained about a year ago a soccer injury. And in one of the very important bones in the ankle, he developed an injury. It's what we call an osteochondral defect, and this defect will unfortunately cause inflammatory tissue to develop. So in order to avoid the knife, which is a possibility maybe in the future, we don't operate, we regenerate. So with that said, we're going to go ahead and use the ultrasound for guidance. And one of the nice things and beautiful things about what we do these days is we use the ultrasound to help us guide us and help us identify the exact area that is affected in order to deliver it to the precise location. So we have here Lisbeth, and Lisbeth is going to go ahead and this is already sterile. And I like to use all these injections we do under ultrasound guidance, again, to make sure that we're delivering it to the precise location. And that's exactly what we're going to do. And again, like I promised everyone, part 3 of 3, we have the injection. Okay. And what we're going to go ahead and do is I'm actually looking, not to the camera, of course, I'm actually looking at the ultrasound. I have located the exact location, and Lisbeth is going to come around and she's going to anesthetize topically the skin. And just so everyone knows, this may seem a little bizarre, but we are inside the ankle joint, okay? And I'm looking at the ultrasound, and yes, we are. So we're going to go ahead and infiltrate the plasma, and the patient will definitely experience some pressure. Are we okay up there?
Yeah. Same problem or different problem?
And we're done. Okay? So, we have injected the plasma into the ankle joint where the patient has the affected area. And usually after the injection, patients will experience a little bit of throbbing. The throbbing will last anywhere between 5 and 10 minutes. We will immobilize the patient's extremity for a certain amount of time, and then we will see the patient back here in about a week. If anyone has, again, I hope this has been very informative to everyone out there. I want to emphasize the importance of patients out there and people interested in any type of regenerative procedure to do their due diligence. Again, not all PRP is created equal. It is very, very important that you ask the right questions. If you guys have any questions out there, please feel free to reach out to us at www.justpodiatry.com. Have a wonderful day. Ciao.